Monitoring our transplant patients with blood tests to pick up early rejection or subclinical rejection is a game changer. I think it's right up there with one of the top 3 or 4 advances in the past 40 years in transplant. Biopsy has a lot of downsides to it. A renal biopsy is expensive, it's invasive, can be painful and uncomfortable. And then there's complications, so you can have bleeding. In rare cases, you can even lose the transplant.
I think when you talk about an invasive procedure, it starts to invoke fear, anxiety, first and foremost because of the physical effects.
Although we think of the biopsy as the gold standard, it really isn't the gold standard because there's so much variability in how a biopsy is read. TruGraf is the only one that's been validated to substitute for protocol biopsies.
The TruGraf process, it's like a one-stop shop. I get the order from the physician, I fill out my documentation, I collect the blood, and boom, I ship it off. I'm not having to go through the prior authorization process so that I can book somebody in an outpatient setting for an invasive procedure. When you're looking at days and you're wondering about a potential rejection episode in a patient, days matter. We could be damaging that kidney. We could be having an advancing rejection episode that we could be treating and stopping.
Well, subclinical rejection can lead to a full-on acute rejection that may be more advanced and more difficult to treat, or it can be a smoldering sort of rejection and you're more in a scenario of chronic rejection, which is untreatable. Using TruGraf allows us to individualize our care. Some patients who would have a stable, normal TruGraf, they don't need as much attention, and we can devote our energies to the patients who have abnormal TruGraf tests.
I think it's really the gold star of healthcare that this TruGraf comes along, and not only is it helping us provide the best outcomes for our patients, but it's simplifying and streamlining the process for doctors. That's our goal of healthcare, is to provide the best outcomes in the safest way possible to our patients.